Hi, and welcome to Keeping It 100 Medicine. I'm Dr. Danielle, a second-year resident, and I remember being super excited and nervous to start residency, so I wanted to give some advice to the interns that will be starting soon. So if you're interested, please keep watching. Every residency program is different, but basically between the day and the night team, you're going to have this sign-out process, and after you sign out with the team, you're going to split the list amongst the residents that are working on that service that day, and then you're going to get your patients. First thing to do is to have a set way to review your patient chart so you don't miss anything before you go see your patient. So I think it's very important to just have that routine down, and I'm actually going to insert a video of how I pre-chart.
So first, we're going to separate our page into the different patients that we're going to have. I'm going to say this in patient 101A. I'm going to write their vitals, blood pressure, heart rate, respiratory rate, O2 saturation. If I see anything abnormal, I'm going to stop right there and go see the patient. If not, proceed to the next step, which is writing out their labs. So you have your sodium, potassium, chloride, bicarb, BUN, creatinine, glucose. We have our white blood cells, hemoglobin, hematocrit, platelets, and then we have our last section, which is going to have our calcium, total protein, albumin, total bilirubin, AST, ALT, and alk phos. So let's say we have a patient and their sodium is low. I'm going to put it in blue just to help me differentiate from the sea of black that this is an abnormal lab value. So I'm going to say the patient has a sodium of 132. And I usually try to trend any of the lab values that are abnormal. So they have 132 today. Day before they had a 135. Day before that was 137. So I'm like, okay, that's really interesting. Why is this patient's lab for sodium so low? Everything else looks normal. I'm going to continue looking at my patient to see what's going on here. So next, I'm going to go to the previous note section. And basically, I'm going to go to their plan part to see what is the patient's diagnosis that they have right now, as well as what are their past medical history that we need to keep in note. So this patient has subarachnoid stroke, they have diabetes, hypertension, hyperlipidemia. I'm going to start to look at their medications, see if there is anything strange going on. Why do they have this sodium, that subarachnoid stroke, this low sodium? I'm thinking syndrome of inappropriate ADH, SI-ADH. So from there, I'm also going to look at the consult notes to see if anybody put anything in there. Let's say there's neuro consult note, cardio. If there's anything interesting in there, I'm just going to jot a quick line from those consult notes as well. Next, I'm going to be looking at the images. They're going to have, let's say, a CT angio, head or brain, whatever. I'm going to put the date and what did I see in there. And then I'm also going to start to develop this to-do list with things I need to do, including getting urine osmolality, urine sodium, anything related to the SAADH that I'm thinking of working up, anything for case management, PT. And while I'm doing this, I have these little boxes on the side, and I'm going to put a check mark when I get through my to-do list.
So now you've finished pre-charting, and there's a lab or an image that's a little concerning to you. What do you do next? So you want to be a little bit more proactive. Instead of just asking your attending or senior resident how to handle something, you could use different resources on the internet or the apps, basically, to kind of help you guide your management. The three resources that I like to use for management is Up-to-Date, Hospital's Handbook, and FB Notebook. Of the three aforementioned, Up-to-Date is like the gold standard, if you will, and it has a lot of information. It's very extensive. It's sometimes a little bit overwhelming, so I like to use the Hospital's Handbook. I like the way that they present the information. It's quick, but they don't have as many topics that are covered. And then there's FP Notebook, which also has a lot of topics that are discussed, and it's just like an easier format, in my personal opinion, to look through. If I had questions on medication, dosing, or adverse reactions, I like to use Hippocrates. And if I have questions concerning like different calculations, such as correcting calcium for albumin or correcting sodium for glucose, I like to use MD Calc, and all these that I mentioned are free. So you have pre-charted, you've addressed any labs or imaging that was concerning, and now you're going to go see your patient. Obviously, you're going to continue to need your stethoscope, your pen light, all those same things you use as a medical student, but there's a few extra accessories that I really love, and one of them is my clipboard. It's from White Coat Clipboards. It has a cheat sheet on the back, and it folds. I love that it can fit into my white coat, so I have free hands and some of my scrubs, but this thing is amazing. And then I used to use this thing called Perfect HMP when I first started, and if I forgot some questions to ask my patients when I was admitting them, I used this, and it kind of had like the ROS questions that you should kind of focus on, as well as the physical exam. So I thought this was great, just especially in the beginning when I was just getting acclimated again to being in the hospital and asking all these extra questions. And then last but not least, I love using multicolored pens. And I see a black ink. It's just nice, for me at least, to kind of differentiate a high versus a low value and like anything alarming. So that's why I love using these multicolored pens. And I can put a link in the description below for these 3 items that I just mentioned. The other accessory I liked was this little cheap laptop that I got from Asus. It was like $200, and because my residency program didn't provide laptops or phones, so I just bought this so I didn't have to bring my more expensive computer. Don't be afraid to be wrong. Just ask for help. I know that I struggle with like second guessing myself, and it's okay to ask for help. You're an intern. You're going to be making mistakes, and there should be people around you to help you from making like a very serious mistake. There's the attending that's there with you. There's the senior residents. There's the nurse. There's the pharmacist. So just don't shy away from asking for help. Be nice to everyone. As a general rule in life, you should be nice to people, even those who give you attitude. And keep that same energy when you're working in the hospital. This is a professional environment. And especially be nice to the nurses, the RNs and the CNAs. These are the people that are with the patient the most. And they can give you some great insight on the patient, as well as like overnight events or how the patient's behaving, their family, etc. So just keep a good relationship with your nurse and everybody in the hospital. Try to find outlets to de-stress. Intern year is extremely stressful and exhausting emotionally and physically. You definitely need to figure out a way to kind of get rid of that stress. So I know on my days off, I work 6 days a week and get 1 day off, and then on that 1 day, I would just like lay and like not move. But it's good to go out with your friends, go to a museum, go to the gym, go to different restaurants, you know, just explore your area. Hopefully you're in a fun place, but if not, you can always have a game night with your co-residents. Just try to do something fun to kind of distract you from the crazy hospital experience. Intern year is known to be one of the toughest years because you're transitioning from being a student and not having that much responsibilities to being a resident and not only dealing with the patient's life, but you're dealing with their family members, your coworkers. It's a lot of different things to juggle at once. But remember, you made it through medical school, so you can conquer anything that comes in your path. You're going to do great, and residency is temporary. Intern year is temporary. This too shall pass. Just got to get it through. And I hope this video was helpful. If you have any questions, please put them in the comments down below. Please make sure to like, share, and subscribe. And I'll see you in my next video. Have a blessed day.